Dental Hygiene Month, and we're going to talk about fun facts, myths, everything that you need to know. Some are funny and some are really serious, so I'm just back to share more fun facts with you. That is a myth. Bleeding gums are not normal. Bleeding is the first sign of bacteria and disease in the mouth, so if you are bleeding while flossing or brushing, you need to reevaluate your home care, floss under the gum line, and make sure that you're brushing correctly and getting a gingival margin. That is a fact. Okay, fruit juices are not healthy for your teeth. Your kids will drink fruit juices when they're little, and people tend to put that in their sippy cups. If you are going to have your child drink fruit juice, it needs to be diluted. The fruit juices have way too much sugar in them. They do cause decay in the mouth, and babies don't need to be just drinking fruit juice all day, every day. It needs to be diluted or just stick to water. And the same for adults. Fruit juice is not good for your teeth, so make sure you are rinsing with water afterwards, or yourself just drinking a lower sugar drink and kind of stay away from the fruit juices. That is a fact. And it's sad, but people do not realize how many people have cavities before they're even in their adult life. Children get them, adults get them, so we have to be aware to make sure we're brushing, flossing right, so we don't get those cavities. That is a myth. The gums should not bleed when you brush or floss, but if they do, that means you just need to continue with your home care because you need to remove that bacteria. If you are brushing too hard, it's because you're brushing too hard and you're using a medium or hard toothbrush. You need to use a soft toothbrush all the time, no matter what. Everything else is way too abrasive for the gum tissue. That is a fact. When you brush your teeth, you're only getting the outside to inside surfaces of your tooth surface. You're not getting in between each tooth, and bacteria sits there. So that is why it's so important to floss daily. That's a myth. Your oral health is for sure related to your overall health. The bacteria in your mouth, it goes down into your bloodstream. Periodontal disease is correlated with diabetes and heart disease, so it is a big deal to take care of your mouth. I mean, as your whole body. So make sure you're taking care of it. That's disgusting, but it's true. That is a myth. Baby teeth are just as important as adult teeth. You may not be keeping them for the rest of your life, but your kids really need to have dental checkups starting around at least 2 or 3. Doesn't mean they have to have x-rays that early, but a doctor needs to check those teeth at an early age to make sure they're healthy, and you want to keep those baby teeth healthy so when the adult teeth come in, there's enough spacing, there's not disease, bacteria. It's just a good thing to get your kids' dental health under control. That's a fact. If you're brushing right. Medications do affect your oral health. That's a myth. A lot of medications cause dry mouth, and dry mouth can lead, when you're not salivating as much, the bacteria sits in your mouth longer, you're not naturally cleansing like you should be, so therefore you can start having decay in the mouth. So it's really important that if you are taking medications that you get control of your dry mouth. If you're experiencing it, there's lots of products that people use to help with their dry mouth. It's just a big deal to make sure to keep your mouth naturally cleansed, drink lots of water, and rinse that bacteria out. That's a myth. Young adults have periodontal disease. It ranges, teens all the way to older individuals. You just have to make sure that your dentist, checks you on. That's why it's so important as a child to be evaluated by a dentist and have their teeth cleaned at least twice a year. Young adults do get periodontal disease. That's That's a fact, people. That is a fact. That's a myth. Do not put aspirin next to your tooth that has toothache. You will get an aspirin burn on your gum tissue. So please do not do that. Just go see your dentist. That is a fact. That's very true. That is why it's so important to take care of the ones that you have, because they don't grow back and they can't fix themselves. That's a myth. Just like periodontal disease, young individuals can have oral cancer. There are cases of young adults that have oral cancer, so your dentist will screen you every time you come in, at least once a year, for oral cancer. It's something that they check for every time. It's not just a smoker's disease. That's a fact. It's really important to make sure you take care of your oral health while you're pregnant, because the hormones can cause weird things in the body, but you want to make sure your mouth is healthy while you are pregnant, because it's harder to do things when women are pregnant. They can't do as much because they don't want to harm the baby. They just want to make sure it's safe. We like to be very conservative, especially while women are pregnant. I'm pretty sure that is a myth. That is not true.
It's a myth.
I haven't heard that one, but that is definitely a myth. That's very true. That is not a myth. If any of y'all watch CSI, you know that dental records is how they identify people. Okay, friends, that wraps it up for our Whiteboard Wednesday this month, but make sure you brush and floss, and I know Halloween's coming up, so just don't eat that much candy, and make sure you floss and brush afterwards. Okay, bye friends!